thank you, first of all, for allowing me the opportunity to speak to you all today. The aim of my presentation is to give you an insight into my experience of having ICP. As Sue has just said, I now work for the charity as the Engagement and Development Officer, so I'm going to explain to you how I ended up in that role. But I'll take you back to my first pregnancy. So I began to itch at 34 weeks. I'd remembered reading something in an antenatal leaflet that I'd picked up about itching in pregnancy and it being a warning sign. So I Googled it, of course, and then panicked. What I found was this that you see on the screen now from the NHS website, and it described my itch pretty accurately. My itch was constant throughout the day and night, and it was all over my body. I couldn't stop scratching, but that didn't give me any relief from the itch. So what was recommended on the NHS website was to get a bile acid blood test to investigate for ICP. My next midwife appointment wasn't until 37 weeks, but from what I'd read about ICP, if I did have it, my baby might need to be born before then. And I knew how busy the midwives were, so I made an appointment with my GP. And I'm now going to share with you my contribution to our 2021 awareness campaign called Don't Ignore the Itch, just to summarise what happened next. I'm going to read this out to you. I reported itching to my GP and asked to be tested for ICP. I was told my midwife would investigate ICP at my 37-week appointment. I didn't feel comfortable waiting for 3 weeks, so contacted my maternity assessment unit. They were fantastic and immediately tested my bile acids. I was diagnosed with ICP and monitored for 2 weeks before an early induction was necessary. My son was born 3 days before that 37-week midwife appointment. I'm so glad I persisted. I'm so glad I didn't wait. And I'm so glad they listened. So what seemed to happen here is that the GP didn't understand the urgency of needing to investigate for ICP and for a management plan to be in place if I did have the condition. I did describe my itch to the GP, and I did say it was mild. Some women do suffer really, really badly with the itch, and my itch wasn't severe, but it was constant. So I think the GP sort of misunderstood then how the itch related to bile acid concentrations and maybe assumed that because my itch was mild, there wasn't that need for urgency. But what I now know is that bile acids and itch don't correlate in that way. So just because my itch was mild didn't mean that my bile acids were low. I left the appointment feeling worried for the safety of my baby, but I also felt a bit silly, first time mum just making a fuss and overreacting. But ultimately, I didn't feel comfortable waiting for 3 weeks. So I attended maternity assessment. And 2 weeks after diagnosis, I was induced, which led to the safe arrival of Rory. It was a very quick induction. He was born at 36 weeks and 4 days on the 1st of March and narrowly missed a leap year birthday by 46 minutes. Well done, Rory. He spent 24 hours in the NICU. They were concerned about his lungs, but we were discharged home. Unfortunately, we were readmitted to the NICU again, but just briefly. And then he was home for good a week later on my birthday. When I was discharged from hospital, I asked about any follow-up checks for myself, which had been mentioned just to check, blood tests, check that everything had come back down to normal and another liver scan. But the staff that I asked weren't sure whether I'd already been referred or whether it was something that I had to chase up myself. So on a night feed, I was back on my friend Google, but this time I found the ICP Support website. Now, as ICP Support is a research-based charity, all the information there was backed up by evidence. There was such a wealth of information and support available as well. While I didn't know about ICP Support during my pregnancy, it became clear that their research and campaigning had massively contributed to the safe arrival of Rory. So once I knew about the charity, I wanted to get involved, and I started volunteering during my maternity leave until my maternity leave finished, and I was delighted to join the team as Engagement and Development Officer. So this is the profile on the ICP Support website. I realised how invaluable the charity's support and information would have been to me during my pregnancy. So I wanted to help them to reach more women so they didn't have to feel isolated like I did during mine. As Engagement and Development Officer, I evaluate and develop the services that the charity offer, and also raise awareness of both the condition itself and of the charity, particularly among families affected by ICP and health professionals. So how do I do this? By creating infographics. So the infographics explain different aspects of what can be quite a complicated condition. We share these on social media just to raise awareness and help explain the condition, and the moderators also use these in the support groups to help answer questions. I also collaborate with other organisations such as Tommy's and the NHS to ensure that their information on ICP is up to date, and also develop awareness campaigns like the Don't Ignore the Itch campaign that I read out to you earlier. I also share my own experiences. So I was very proud to be included in the What Your Patient is Thinking series in the British Medical Journal. So this series aims to help health professionals reflect on their own practice and think about how they can better support their patients in their care. I've also shared my story on the ICP Support website along with lots of other women, so I'd encourage you to read those and you can hear lots of different experiences of ICP. And again, through awareness campaigns, sharing not only my experience but other women's experiences too, and of course in presentations like this today. So that's what I was doing, keeping myself busy with ICP support. And then here comes little itch number 2. So there's around 60 to 90% chance of developing ICP again. And although in this pregnancy I felt much more empowered, supported and informed, it was hard not to worry. There is no ignorance is bliss after you've had ICP, very different to the first pregnancy. And I did feel like a little bit like a ticking time bomb, sort of waiting for the inevitable to happen. But having said that, I did feel more empowered and was able to advocate for myself and my baby, which I wasn't able to do in my previous pregnancy. And I was aware of new research that hadn't been included in the RCOG guidance at the time that I was pregnant because it was under review. So I was armed with a lot of knowledge. That all led to the safe arrival of Maeve. She again was induced at 39 and 3. She was treated for jaundice but didn't need any NICU time. During this pregnancy, my bile acid concentrations were much lower than with my pregnancy with Rory. With Rory, they got up to 71, but with Maeve, the highest they got was 18. But despite that, my itch was the same in both pregnancies. Again, lucky that it was mild for both, but that just reiterates that you don't know what your bile acids are doing based on the itch. So any itch should be investigated. The only way to assess the risk to your baby is through non-fasting bile acid tests. So 2 very different pregnancies. My first pregnancy, I'd never heard of ICP until I was diagnosed with it, so I didn't have any knowledge of the condition at all. I wish I'd had the opportunity to access the support and information that ICP Support provide during my first pregnancy. ICP Support are not health professionals and they don't claim to be, but they are experts in the condition and they are involved in research into ICP. So I'd encourage any health professional to signpost to specialist organisations like ICP in order to complement clinical care. And on that note, the lovely Jenny Chambers, who you will hear from later on, our CEO and founder. She provides presentations that covers all things ICP, and it would be a great time to book that in if you're interested, because the RCOG guidance has just been updated. And we appreciate that it's incredibly difficult to have in-depth knowledge of lots of different pregnancy conditions, to keep up to date with research and how that impacts on the clinical care. And we want to work collaboratively with health professionals, so that is one way that we can do this. Please do get in touch with me if you're interested in that. My email address is here, but it's also available on the ICP Support website. I am on mat leave for another 2 weeks, but I will return. I am returning, and I'd love to hear from you. And all that leaves me to say is thank you very much. I hope that's been helpful. Here's another picture of my little itchies as they are now, Maeve and Rory, and they've got their little ICP Support t-shirts on. Thank you very much.